Dr. Patel, can you walk us through a real patient you've treated with spinal cord stimulation, what their life looked like before, what made you recommend SCS, and what changed for them after the procedure?
When I think about my typical patient with a spinal cord stimulation need, I am typically presented with a patient who's had years of back surgery pain and has back surgery before this is considered. These are individuals that have back pain throughout their life, have tried various injections and interventions, and then have had surgery but have residual pain for years that escalates to a point where they're not functional. So before they get spinal cord stimulation, these are individuals that are constantly taking pain medications, are bedridden often, they can't do activities of daily living. They have spasms all the time. Any movement hurts. They have pain radiating down their legs. Some of them are incontinent. And it's a very depressing place for people. Once they have spinal cord stimulation, I think the switch is pretty abrupt. Without pain medications, they see their life and quality of life just drastically increase and improve. Their activity increases, their pain medication usage decreases, their involvement in the community and their family and their presence improves. It is pretty much a life-changing therapy, and that's why we often prescribe it, because it's one of those therapies that if it works today, it works in 10 years. It's unlike other therapies that may dwindle in their efficacy. Spinal cord stimulation is something that once you try it today, and if you choose to go forward with it, it helps you throughout your life. So in terms of what it looks like before, it's a night and day difference.
Is this procedure available at your SEVA clinic in Tulsa?
Yes, all SEVA clinics and locations in Tulsa and Oklahoma and New Mexico offer these therapies for people who have sciatica, neuropathy, pain going down the leg, and failed back syndrome, particularly those who've had laminectomies and lumbar fusions and have had pain after those surgeries.
Okay, thank you. And most people have never heard of spinal cord stimulation, or they picture something outdated and scary. Can you explain in plain language what is actually happening inside the body when SCS is working, and how is the technology different today compared to even 5 years ago?
It may appear scary when someone thinks about an implant, but this is something that's been around for more than 2 decades and has had an incredible renaissance recently because of the advance in technology as well as physician adoption. So physicians have become more proficient in installing these, and the equipment's become much better. So we're in a number of benefit for patients, and the healthcare arena for pain management has drastically improved. So spinal cord stimulation typically intercepts pain messages from the foot, leg, thigh, buttock, back, SI joint, lumbar facet joints, and the low back area to prevent those messages from reaching the brain. We've recently found out that high frequency, such as 10,000 hertz or more, where you don't have paresthesias, where there's no buzzing, no tingling, it just replaces pain with no pain. So this is an FDA-approved device. It's an FDA-approved therapy. It's one of those few things where you get to try it before you buy it, where we have a trial period for a few days, and the patient makes the decision whether they want to move forward or not. And for those people who have had long-standing back pain, this is a life-changing thing. So they know within a day or two whether they like it or not, and they want to move forward. Most of my patients come back saying, please don't take the trial out. I love this thing so much. We do have closed loop therapies now, and they adjust to your body posture. Some of the most advanced options are available at our SEVA clinics. When you go to other facilities, they often have some antiquated or older facilities, or they only work with certain companies where they have access to it, or they use the cheapest option. With us, we use the most advanced therapies and the latest technologies so that you have remote recharging. We have a battery that lasts over a decade. You charge it through your skin. You have an iPhone-like device to control it, and it's extremely easy to use. And the closed loop or burst spinal cord stimulator options are very, very much available with our programming.
Okay, thank you. Thanks for the valuable information. And just one last question I've got for you here. If someone is watching this and they've been living with chronic back pain for many years, maybe they've had surgery, maybe they're on medication that isn't really working for them, what would you say to them directly? And what should they look for in a specialist before considering SCS?
For someone who's living with chronic back pain for years, the first thing I'd say is get to your pain management physician as soon as possible. Even if you haven't had surgery, spinal cord stimulation may be a good option for you. But certainly the person who's had a failed back or hasn't recovered from surgery, this is a therapy that you absolutely want early rather than late, because you don't want to escalate pain medications and non-steroidal anti-inflammatories and get side effects of taking more and more steroids or other medications on your entire body before you consider this, where there is no side effect when it's installed and works. And I want to emphasize that once you have installed a spinal cord stimulator, you remove the risk of constant injections, constant medications 2 to 3 or 4 times a day, the poor sleep issues. You have a trial, you know it's going to work. And when the trial works, you're convinced this is going to help you, and you move forward without a chance of it failing. When you have surgery, you don't have that option. You don't know if it's going to work. You don't know how you're going to get off the operating table. With spinal cord stimulation, you absolutely get to try it for 2 or 3 days or up to a week, and you know pretty quickly whether you want it. When you're looking for a provider, you want someone who's board certified. My recommendation is to find someone who's board certified in anesthesiology or physical pain medicine and rehabilitation. And typically, if people have had a fellowship training, and I think 5 to 6 years of experience, I recommend looking for a doctor who owns or practices in their own surgical center or their own office, because they have full control over the technology they purchase, buy, and program. Plus, they're going to give you that follow-up care that you really need. And if you do it at a hospital or somewhere where it's a big corporate enterprise, you don't know who's going to be taking care of you afterwards, and you want that sort of guarantee. So looking for a more niche, specialized clinic rather than a big institution is the better way to go. At the locations in Dallas, in Oklahoma, as well as New Mexico, the SEVA Healthcare system is really advanced in this, because not only does it bring the best technology, it brings the best technicians before, during, and after the installation of this procedure. We at SEVA, they have same-day consultations. You can get in that week. You can have a chat with the doctor. You can do a telemedicine visit to really see if this is an option for you. So if this is something someone is suffering from, I encourage them to book an immediate appointment with a pain management doctor with someone like SEVA Healthcare.
Wow, and something that really stands out to me is that you can actually try it for a trial period. How long is that usually?
You know, with spinal cord stimulation, whether it's a peripheral neuromodulator or a central neuromodulator, most people know within 24 hours. With the newer technologies, there's sometimes a 24-hour washout period where it starts working, and then it really works for a long period. So we give them 3 or 4 days, but up to 7 days is a usual trial. Most people have made that decision in 3 days, and they come back and have it removed. It's very easy to remove. A medical assistant can remove it, and it takes about 5 or 6 seconds. So it's a really easy procedure to do that trial.
Okay, great. Well, thank you so much for your time and all of that information, Dr. Jayen.
I appreciate you, Jess. Have a good day. Thank you.